Welcome to today's Practice Advantage Pearl. Today we're delighted to have with us Ward Tongan, a digital marketing strategist who has some experience in both the medical device industry as well as the legal industry, the legal publishing industry over the past several years. Ward comes to us also as the current president of the Minnesota Search Marketing Association, and his current position is with Medtronic in digital strategy. So bringing that expertise to us today, I think about we have a busy communication milieu for people in today's world. Physicians are using things like websites, hospitals are using websites, clinics are using websites to really tell their story. We know that with all the different kinds of traffic out there, 80% of the people in America today, in North America today, do use the internet. Of that 80% of the people are using it to find some healthcare information. And of that 80%, the third most popular reason why people are going to the internet for healthcare information is to find a provider, find a physician that they can team up with. So there's a lot of noise going on out there. How does a physician optimize their particular presence on the internet? Ward, this is your expertise. Can you share a few pearls with us on SEO?
Sure, Dale. As you know, SEO stands for Search Engine Optimization. And before we can really talk about search engine optimization, we're going to have to back up and talk about keyword research. Now, keywords are the words that you want to have on your website to make it relevant for people searching for your web properties in search engines. And so you want to make sure that these keywords are done in the vernacular of your target audience. For example, how would you search for yourself versus how would you think that one of your patients would search for healthcare information trying to find a healthcare provider? Medical terms like bladder control, would that be relevant to your target audience? Or would they be searching for a term like incontinence instead? So by choosing good keywords, we can then move on to SEO. The other thing you want to do with your keywords is identify synonyms to your primary keywords, because you want to kind of cover the gamut of all those words. And so that brings us to SEO, and SEO is developing web content that incorporates these keywords on your web pages in a way that makes those pages relevant for people that are searching for health information that your website is relevant for. You want to beware of agencies or consultants that offer you high rankings in the search engines without the associated work of obtaining good keyword research and writing good copy. I think a good web copywriter is really all you need to write a good website. They'll know the ins and outs of optimization, things like title tags for your web page, meta description tags for web pages, and these should all be unique to each web page on your website. Header tags, also known as headings for your website. These need to include your primary keywords as appropriate, phrases worked in there, but it also needs to be well written. It needs to be informative, valuable web content that addresses the needs of the visitor to your website that's looking for this information. Also, the links on your websites, wherever they link, should be contextual. In other words, contextual to the page that they link to. A phrase like "click here" is not contextual, so you want to do better than that. I'd also like to talk a little bit about local search. Local search helps visitors to your website find you via geographic terms because they're looking for a local clinic or a local physician. So you want to be able to appear properly and accurately in places like Google Maps. So what you should do is make sure and verify your ownership of your website in places like Google Places, Yahoo Local, Bing Local. There's a verification process that you can go through to get your business listing into these important, valuable web search engines from a local aspect. Also, it's a good idea to put your address and phone number on all of your web pages. That way, the geographic information is associated with the content on the page. Perhaps you could put your address and phone number, for example, in the footer of every page of your website. You also want to use geographic terms in the body of your website. Things like Minneapolis neurologist or Chicago chronic pain clinic. These are things that are going to associate locations with the important keywords on your website. Also, lastly, I'd like to mention online directories. Online directories are kind of like the Yellow Pages online, and patients use these directories to find physicians on the internet all the time. And so you want to make sure that you're listing in those directories and put your listing in the major directories as well as provider directories, payer directories, and make sure that they're accurate and consistent. And Dale, that's kind of the basics. But if you follow these strategies and tactics, you'll have a good chance of having the practice advantage of getting more qualified traffic to your website.